in ICUs. We've called them heroes, stars, lifesavers because in so many cases they are. But Kern County physicians on the front lines of the pandemic can't help but notice the fact that by and large local residents have not been enamored of the one thing that could make the jobs of health professionals easier. 17's Robert Price found one doctor who has noticed, and he files this report.
Kern County vaccination rates are among the lowest in the state, and COVID units around the county are filling up. How do local doctors feel about that? Well, I found out. Dr. Jonathan Dario is medical chair at Adventist Health Bakersfield, and in that role he's seen literally hundreds of patients suffering from the symptoms of COVID-19. Most recover, at least well enough to go home. Too many don't. And in a few cases, even as they lie on their literal deathbeds, they've denied the severity, even sometimes the existence of COVID-19.
I've experienced patients who say they don't really believe they're as sick as they are. COVID was real. Maybe that's the reason why they didn't have the vaccine.
But he's not angry, can't afford to be. Every patient deserves the best version of their attending medical professionals, he says.
I'm not going to be mad at my patients for choosing that they don't want to get the vaccine. As a physician, it would be my wish that to talk to them.
The vast majority of COVID patients, and the sickest of them, are unvaccinated. The percentages go up and down over the course of a few days, but at both Adventist and Dignity hospitals last week, unvaccinated patients represented 95% and up of hospitalized COVID patients. Dr. Dario has heard all the excuses for choosing not to vaccinate. His favorite is that mRNA vaccines, Pfizer and Moderna are examples, were rushed into wide use before they were adequately researched.
Even though this is a much more broad use of the mRNA vaccine, they've been testing it for many years, especially when they met the first SARS coronavirus. But by the time that they had it ready, unfortunately, or actually a good fortune, was that that virus had pretty much died out. Essentially, that's the research that made it viable that we were able to actually even have a vaccine so soon.
Dr. Dario said he has, on occasion, overheard people discuss COVID-19 and the COVID vaccines, and in the process repeat false or debunked claims. Is he ever tempted to interrupt and introduce himself?
Of course, I've heard it. You know, if you're out and about, of course, you hear people talking. I've had the urge. I haven't myself gone up to them.
What, I asked him, is the one bit of advice you've got to offer that people should heed?
The vaccine is your cheat for all of this. You know, you're getting ahead. You get to get something that's going to make you essentially stronger. Your body already has the tools.
Dr. Dario said vaccinations are a personal choice. But he said if he were the chancellor of a university system or the owner of an NFL team, he'd require it. At Adventist Health in Bakersfield, Robert Price, 17 News.
So we already know that